There are 6 compartments of extensor retinaculum, which is situated on the extensor aspect of radius and ulna at its lower rim, and they are counted from lateral to medial side, that is from radial to ulnar, or you can say lateral to medial side. First compartment, second, third, fourth, fifth, sixth. First compartment carry the anterior boundary maker of anatomical snub box. Anatomical snub box, we all know, when we stretch our thumb, there is a depression appear, which is commonly used to make canny, and we all know the oral cancer is most prevalent in India. So we will also memorize the canny, which is common in India, and anatomical snub box. So anterior boundary maker is the adductor pollicis longus and extensor pollicis brevis, the anterior boundary maker. Second compartment who give passage to the two brothers, the big brother and the small brother, that is extensor carpi radialis longus and extensor carpi radialis brevis. Big brother, small brother. Third compartment, the posterior boundary maker of anatomical snub box, that is extensor pollicis longus. To pass from the fourth compartment, you have to show ID, identification document. So extensor indicis and extensor digitorum. Fifth compartment, we all has got 5 finger, and the fifth finger is very small, little finger is the fifth finger. So extensor digiti minimi, which is going to the fifth finger. And sixth, we all know most medially is the ulna, so extensor carpi ulnaris. We can also memorize by the food pattern, and upbringing of a child. In his early age, we used to give the baby apple and एकदम पका हुआ banana. The एकदम पका हुआ banana. In first year, the child used to eat apple and एकदम पका हुआ banana, that is fully ripened banana. Okay. Now when the child become of 2-year age, then we used to give karela. All are extensors, as this is the extensor aspect, so extensor as well as the abductors. So extensor, it is common, and now it is karela, and C also sounds as chaw, so charbi. We used to give karela for rising its immunity and charbi for the taste and growth. Okay. Now at the 3 year, the child also eat with his own interest, like ekdam pakki hui lychee. Okay. Now at the age of 4 year, we become very anxious for making his ID, that identification document like Aadhaar card, etc. And when the child becomes 5th year, they are going to missionary school. So missionary school. And at the age of 6, we used to dream that our child become ekdam unique, ECU, ekdam unique.